Delhi frequently experiences air pollution that reaches levels that pose severe health hazard. Pregnant women and their unborn babies are especially the ones who are vulnerable and at risk. Let's take a look at this report, which in fact breaks down the hazardous effect of the dipping AQI in the national capital.
Ashma Gupta and her husband are worried about the health of their unborn child.
I'm here to see my doctor because I'm feeling anxious and having trouble breathing.
Air pollution in Delhi is at hazardous levels, and Ashma wants to see a gynecologist to check her baby is not in danger. It's due in 1 month. A doctor's assistant measures high blood pressure and reduced activity of her unborn child. Dr. Aparna advises Ashma to stay indoors, like many of her other patients. She has seen a sharp rise in pregnant women complaining of breathing difficulties and mothers forced to give birth prematurely.
There are multiple factors of preterm delivery, but one of them is air pollution, because the level of air pollution is very high in Delhi this time, and every pregnant women are having some breathing issues, respiratory issue, breathlessness and pain abdomen. That's why there is increased chance of preterm delivery.
Delhi is one of the most air polluted cities in the world. Many of them are in South Asia. And medical studies show that the region has the highest rates of pregnancy loss globally. Experts say there is a link. In India, some activists blame the health crisis on a lack of political will to balance rapid development with environmental protection, pointing out that there are some who suffer more than others.
See, the toxic smog is affecting everyone in the city. It is not going to spare anybody, but it's the underprivileged, who are the most vulnerable.
Meet Lalita Devi, a daily wage laborer working in construction. She is one of the many invisible hands that power India's economic growth. She is due to give birth in a few months and has no way to protect herself from toxic fumes. Her home in the slums offers no insulation, and she has to go out to earn money.
I have 3 children to feed. We're poor people. If we don't go out to work, how will we survive?
It's taking a huge toll on her health.
Sometimes I cough. Sometimes I get a headache. I feel dizzy and I can't stand for long. My back hurts at times, and when I think about my child, I feel uneasy.
It's stories like Lalita's that make Baurin Kandari angry. The activist says it's time authorities take action and start protecting the lives of mothers and children.
We expect from the government nothing short of clean air. This is what the citizens want. This is what the Article 21 of our Constitution says. For our children, it's our right to clean air, clean water.
And that right, she says, applies to all mothers and children, whether they are rich or poor.
तो आप लोग जब खाना बनाते हैं तो बच्चों को बाहर कर दीजिए 2 घंटे के लिए.